Hi, my name is Michael Chaiton. I am a senior scientist at the Center for Addiction and Mental Health and the PI for the Smoke Free Connect project at CAMH and the University of Toronto. And today we're going to be talking about the health effects of e-cigarettes. And in particular, the work that we did on trying to understand what those health effects were through what was called the Vector Project. The Vector was a project that was funded by Health Canada to investigate what we know about how harmful e-cigarette products are on four different categories: cardiovascular health, respiratory health, cancer, and nicotine dependence. We were part of a team that looked into the literature and evaluated all of the studies that we could find that had looked at those disease relationships for e-cigarettes, and went to an expert panel to make recommendations both for clinical and public health practice. The over panel came up with a number of recommendations based on the health effects found for e-cigarettes products. These can basically be summarized into three different categories. First, if you're a non-smoker who has no experience using nicotine, then there are significant and real health effects associated with e-cigarettes, and you should not use e-cigarettes. Second, if you are a current smoker and having difficulty in quitting, it is likely that switching to e-cigarettes would be beneficial to your health, that there's evidence to suggest that e-cigarettes are less harmful than cigarettes when used concurrently. But that three, if it's possible that people who are using e-cigarettes and have no risk of going back to cigarettes should think about limiting their long-term exposure to e-cigarettes. So I'm here today with Anasua Kundu, who is a PhD student at the University of Toronto. And she has led the literature review component of Vector. And now four of the papers from the Vector project have been funded. We'll post links to those papers in the comments below. Today, we will talk about those literature reviews, about the process of doing them, and the main findings associated with the health effects of e-cigarettes. So thanks, Anasua, for joining us today. And this was a really enormous project. We reviewed a huge number of papers, and you were the main person in charge of the scientific process of this. Would you talk a little bit about sort of the methodology for that underlied all of the papers that we'll talk about here today?
Thank you, Dr. Chaiton. About the methodology of the papers, so we conducted mainly four systematic reviews and meta-analysis to look into the cardiovascular effect, respiratory effect, cancer, and vaping dependence. So to do that, we looked into the previous reviews too. So several reviews have been published in the recent years. One of them is the 2022 McNeil et al. Review from the King's College London, and they looked into the first three health effects. So for these three health effects, we looked into the literature that were published after their review. The McNeil et al. Review did not look into the vaping dependence. So for that, we considered the National Academy of Science, Engineering and Medicine report published in 2018 as the latest comprehensive one, and we included paper since then. So we looked into all this paper, so we can mainly look into the absolute and relative risk of using e-cigarettes and having the health effects. So absolute risk is like if someone who is using e-cigarette but never used cigarette or not smoking cigarette, what is the risk of the health effect in those people? And the relative risk is whether this risk among the people who are using e-cigarette compares to those that is seen among the exclusively smokers or people who are smoking cigarettes. So we looked into these effects for these four different category of risk and came up with some of the substantial findings.
Yeah, and so that's important because who we use as a comparison group makes a big difference especially for looking at e-cigarettes. That comparing some exposure to nicotine and the other substances, intoxicants in e-cigarettes to no exposure compared to the thousands of chemicals that are in cigarettes and among people who may have smoked, the health effects for people who may have smoked for many, many years. Teasing those apart is a really crucial part of the job here. So let's start with our first disease category in cardiovascular. So are e-cigarettes harmful to the heart?
We conducted mainly meta-analysis on two health risks. One is heart rate and another is blood pressure. And we found that using e-cigarette acutely increase both heart rate and blood pressure. But this acute increase in heart rate is actually lower than smoking cigarette, but the acute increase in blood pressure is similar to smoking cigarette. Now, we also looked into the resting blood pressure and heart rate measures. And we found that the people who are exclusively using e-cigarettes, but not cigarettes, they have no difference in their resting heart rate and blood pressure compared to people who are not using either products. In addition to the heart rate and blood pressure, we also looked into the other risks. Papers from those not included in the meta-analysis, we found out that e-cigarette is associated with some risk with endothelial dysfunction and remodeling of the heart and cardiac dysfunction.
So what does that mean? Are e-cigarette users at a higher risk of like long-term hypertension?
From our findings of meta-analysis, we can say that e-cigarette use immediately increase the blood pressure, but there might not be any residual effect. So that's why we did not find any difference in resting blood pressure among exclusive vapors and non-users. However, whether they develop long-term hypertension or not, this question need to be answered by further prospective longitudinal study. So we need to follow up people who are using e-cigarette and follow up them on long term to see how many of them develop hypertension compared to the as usual population.
So what we know now is we've got good indication that some of these biomarkers of long-term health effects are increased compared to never users. So that we have a good suggestion that this might develop into longer term heart damage, but we need more research to understand the actual associations there. What about
So
other cardiovascular components like heart attacks or stroke or other vascular disease?
well, we could not conduct any meta-analysis to assess the risk, but the paper from our review shows that we did not find any apparent association between e-cigarette use and cardiovascular events like myocardial infarction, stroke, or vascular dysfunction on the long term. But still, we have very limited information, so we need more research on these aspects.
So the same story here, that we have indications of the early biomarkers appearing in higher among exclusive e-cigarette users, but we don't have enough long-term follow-up or enough data to really make a conclusive conclusion about the long-term effects. That we expect to see those associations, but we don't yet have the research. What about the relationship for people who are switching? Is it that we see that heart rate and blood pressure were lower in exclusive vapors? Is that does that indicate some evidence that vaping might be safer than smoking?
Well, we have some evidence on that, and we found that switching from smoking to vaping on the short to medium term, it actually improves the blood flow and blood pressure, particularly among females and younger population. So, what does it mean? It means that by improving blood flow and blood pressure, there is actually lower risk of atherosclerosis and cardiovascular event, and also lower risk of developing hypertension. But this finding is based on one randomized control trial, so we need more research going in the future to confirm this evidence.
Okay, let's turn now to respiratory health. What are the key findings in the association of e-cigarettes and respiratory health?
We actually conducted meta-analysis to assess the development of respiratory symptoms from e-cigarette use and also the risk of COPD, which is chronic obstructive pulmonary disease. So, from our findings, we can say that people who are exclusive vapors or exclusive e-cigarette users, not smoking cigarette, they had higher risk of developing respiratory symptoms compared to people who never used e-cigarettes. However, their risk is lower than people who are exclusively using cigarettes or exclusive smokers and also dual users of cigarettes and e-cigarettes. Now, in case of COPD, we found no apparent risk among people who are exclusive e-cigarette users compared to the never users. Our meta-analysis finding is not showing any risk, but we have some papers which are not included in meta-analysis which shows that there might be some risk of developing COPD in the long term.
Okay, so I mean, the short story is that it's similar in some ways to the cardiovascular results, that we've got pretty good indication of the biomarkers increasing that would suggest that long-term health is damaged, and maybe even some stronger evidence associated with longer-term effects, with even more results that suggest that we're very likely to see impacts from vaping, which is this is kind of consistent with the sort of the mechanism of action that that e-cigarettes do introduce foreign particles into the lung, and we would expect that those particles would have an effect on respiratory health, just the same as any other sort of constant exposure to a pollution or other materials might have. So, how strong is the evidence in your review?
Well, our meta-analysis findings, there is some limitation of our meta-analysis findings. First of all, that our studies are very limited. We included very little number of studies in meta-analysis. Hence, our confidence on the meta-analysis findings is low to very low. However, we have some studies that are not included in the meta-analysis, but those evidence, we can say that we have moderate certainty or moderate confidence that e-cigarette use is associated with increased risk of respiratory symptoms, COPD, asthma, and lung inflammation and damage.
Hmm. And so, why couldn't we include them in the meta-analysis?
So there are wide heterogeneity between the studies. So the different studies have used different measurement metrics and different methodology. So that's why we could not combine all the papers in the meta-analysis.
Mhm.
But still, we can say from the narrative findings that there are some risk
All right, that
associated with cigarette use.
we have some consistent findings across a variety of different outcome measures, a variety of different ways of looking at the association and particular outcomes. But because those outcomes vary, you can't statistically combine them into one result.
Yeah.
Okay, that's important. And so for the simple finding, what about dual use? And for people who are both vaping and smoking, is that worse than just smoking alone, or does it not seem to make a difference?
Well, the dual users, in case of dual users who are using both cigarettes and e-cigarettes, we found that they had higher risk of developing both respiratory symptoms and COPD compared to the never users, and their risk of level was almost similar to the smokers, exclusive smokers. From these findings, we came from the meta-analysis. So from that perspective, we can say that dual use associated with definite risk and their risk level is almost similar to the exclusive smokers.
Hmm. So let's turn now to cancer. What about cancer? Does e-cigarette use increase the risk of cancer?
Well, in a nutshell, we don't know. Our findings on this aspect was very limited, so we could not conduct any meta-analysis to quantify the risk. However, our population-based data do not show any definitive risk of lung cancer or any other cancer from e-cigarette use. Um, I want to mention here that we found several biomarker-based data, which was mainly preclinical studies and lab-based studies, which showed that e-cigarette use is associated with oxidative stress, cell apoptosis, DNA damage, and some genetic alteration that is related to tumor growth. So it appears that there is a risk of developing cancer, but to quantify it, we need more research in the future, particularly prospective longitudinal study, so we can see that whether the people who are using e-cigarettes, whether there is any risk of developing cancer in the future.
Yeah, I mean, in some ways, it's not surprising that we didn't find this association with cancer. Cancer takes a long time to develop. There's a long latency period between exposure. And even in cigarettes, it can take 20 or 30 years of heavy use before we start to see effects on cancer. And so, because e-cigarettes haven't been around that long, and most people who have used cigarettes, e-cigarettes traditionally, have been also smokers, it's hard to really understand what the true impact of that is yet. I mean, what we can say now is that it's not an incredible instant effect, but there's likelihood because of those biomarkers that we might see some long-term impacts in the future. So finally, let's turn to dependence. So what's more addictive, vaping or smoking?
Well, we conducted several meta-analyses to answer these questions, and our meta-analysis shows that e-cigarette dependence is similar to cigarette dependence. Like people who are exclusively vaping and not using cigarette, they have the same level and prevalence of dependence as people who are exclusively smoking. So I will say that cigarette is as addictive as a cigarette.
So it can be. I mean, and that's one of the maybe the mechanisms that we use for e-cigarettes to help people quit smoking. That, there are literature reviews and a major meta-analysis conducted by the Cochrane Review, which found that e-cigarettes were effective at quitting smoking. And one of the ways they do this is actually through substitution, that people become addicted to e-cigarettes rather than cigarettes. And because that they are as addictive or close to as addictive as cigarettes, that becomes an effective substitution method. It makes them better at helping people quit smoking than some other products, although people then have to address the long-term dependence of those later. But it's still, as we've seen from some of the other substances, there are direct health benefits from switching from cigarette smoking to e-cigarette use. So, do we know anything more specific about dependence? So dual users, are they more addicted than people who are just vaping?
We also conducted another meta-analysis to see that whether the dependence level varies between dual users and people who are exclusively using e-cigarettes but never smoked cigarette. And we found that dual users has a higher level of dependence than people who are exclusive vapers but never smokers. So yes, which is very expected because these people are also using cigarettes and e-cigarettes. They should be higher dependence from the additive effect.
And do we have enough information to be able to determine whether different products are more or less associated with dependence than others for vaping?
Well, we can comment on some things. Like we found that nicotine containing e-cigarette use is associated with higher dependence than non-nicotine e-cigarette use. And we also found that this dependence depends on nicotine concentration, frequency, and duration of use. So, for example, people who are using high concentration nicotine, they have higher dependence than low concentration nicotine e-cigarette use. And also, people who are more frequent users and using e-cigarettes for long term, they had higher dependence than infrequent users and newer users. But compared to that, we can yeah, whether e-cigarette dependence is associated with other product features, like whether it varies by the product flavor, whether it varies by device, and whether nicotine product type. We did not find any strong association of dependence with variation of the products, but still we need more research on this aspect to see whether this different type of product use is associated with different levels of dependence.
Hmm. So, what are your top recommendations for new research? We clearly need much more. There's a lot that we don't know about the field of the association of vaping harms. What do we need most urgently?
We have, you are right, we have several questions that we still need answers to. Particularly, we need answers to whether the endothelial dysfunction and cardiac dysfunction that we have seen for cardiovascular effect, whether it causes any long-lasting cardiometabolic events, or whether e-cigarette use is associated with long-term respiratory effects like COPD and lung inflammation. And again, we need answers for whether it causes cancers or any type of cancer or lung cancer. So to do that, I recommend that we need more longitudinal prospective study, mainly case control and cohort study, and also some experimental studies like randomized control trial to see if there is any causative association between these effects and e-cigarette use. We also need to identify or quantify the risk levels in different populations. Like what is the risk level in people who are only using e-cigarettes but not cigarettes,
Hmm.
people who are using both products, and also people who are former smoker but they quit and used to using e-cigarettes.
So we need more quantification of sort of what the actual levels of risk here. The expert panel came up with, there were varieties of the specifics of the recommendations, but in general, they were along these lines that people who don't smoke shouldn't use e-cigarette products because it will be harmful to their health. People who switch from cigarette products to vaping products are probably benefiting their health. And that ultimately, probably long term, it would be beneficial for people who are using e-cigarette products to stop those as long as there's no danger of going back to smoking. Do you think that any of the new research will affect that? Should we be confident in those kind of broad recommendations based on what we know now?
I think we are pretty confident about the recommendation from based on our current evidence, and I think that in the future research we will establish this conclusion by further research. But this evidence is based on current knowledge, so we need more findings to quantify and establish this conclusion.
Hmm. And particularly as new products enter the market and new ways of using these products emerge, well, it's important for us to understand sort of what those levels of risk are. There are very different perspectives on what that magnitude is, and that magnitude does make a difference for some implementation of policy. There are people who think that e-cigarettes are, have almost no harm associated with them, and that has a very different level of policy implications than those in even a moderate level of harm. It doesn't change the main conclusions about who should use e-cigarettes or when they should use it, but it may have impacts for how available these products should be and so on. And so that's why it's important for us to understand more about the ultimate health effects of e-cigarette devices.